So palliative care is a specialty that focuses on the relief of suffering and distress and symptoms in anyone with serious or terminal illness. And it's an approach towards holistic care where you're focusing not just on physical illness and symptoms, but on what we call total pain, which is the physical, the psychosocial, sometimes the financial, the transcendental, and the spiritual distresses that come with suffering and illness. Palliative care can see someone at any stage of their disease and with any estimated life expectancy. So the people who can benefit from palliative care are anyone with any stage of serious illness, whether it be end-stage heart failure, late stages of lung disease, kidney disease, or at any stage of a cancer diagnosis. We can help alongside primary providers, whether it be a cardiologist, a hospitalist, an oncologist, in pain and symptom management and focusing on holistic care of a patient. Palliative care can be provided in any setting. However, it is predominantly provided in the hospital setting. It can also be done in the home where we can follow people longitudinally, either to help them with pain and symptom management for their serious illness. And sometimes we can even do it in outpatient clinics. Predominantly, a lot of what we do involves supportive counseling, identifying where the areas of suffering are, and things that we often don't think about, such as spiritual suffering, which is very, very common in serious and terminal illness. I often find people tell me things like, the reason I have cancer or the reason I have this lung disease is because God is punishing me. And so specifically addressing spiritual suffering, or sometimes there are other dynamics within the family that can be psychosocial, and specifically addressing those. Outside of psychosocial support and supportive counseling, a lot of what we do is symptom management, and that's really where palliative medicine thrives. We tend to do very well with pain management. If you have issues with shortness of breath, we're very good at handling that. Persistent nausea, vomiting that have not really responded to traditional medications and conventional therapies, we often come in and help with complex symptom management.